If you spend 6 hours a year with your endocrinologist or a diabetes nurse or an educator or a dietitian, if you spend 6 hours a year with those kinds of services, and, if you've had a lot of problems, you might spend more than that in a particular year, but most years, that's more than you will spend. That leaves, including leap years, that leaves 8,760 hours a year that you were on your own. And that's why we need ongoing diabetes self-management supports like DiabetesSisters. I sometimes think that that's the most important thing about diabetes, that it's for the rest of your life. And so that's where diabetes self-management support comes in. That final S is flexible, available support that helps you deal with issues as they come up for the rest of your life. Biology is important. Diabetes is a biological disease. People with diabetes need good medical care. But it's also psychological. It's also behavioral, as we mentioned. And our research and the way we approach care has not reflected that reality. For example, in 2024, in all the papers published on diabetes, only 3.5% address psychological, educational, or behavioral aspects of diabetes. So the field and sort of the establishment is still very oriented toward the medical and the biological. And it's not that, I don't want to reduce funding or the availability of good doctors and nurses one iota. But I do want to see expansion of funding and resources for the psychological and behavioral and educational aspects of diabetes.